Welcome to part two of our episode, Restoring Your Aging Immune System. Hi, my name is Jerry Hickey. I'm a pharmacist who also has studied nutrition, and I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about the steps I take to support my immune system, including food, supplements, how this can help you retain your health and vitality for years to come. Please be sure to subscribe to the Invite Health podcast, and please leave us a review. And you can follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get back to it. Probiotics and fiber. They found that a healthy person has hundreds and hundreds and hundreds of different strains of bacteria in their intestines, including strains of yeasts, including viruses. And a number of things decrease them, cause a decline in them. And they found that these bacteria are intimately involved with controlling the immune system. About 70% of your immune cells come in contact with your digestive tract. And there's an interaction between them and gut bacteria. And if you don't have sufficient quantities of controlling healthy bacteria, the probiotic types, the bad type tend to confuse and activate the immune system. And this is implicated in a lot of bad things. One thing is leaky gut syndrome. Toxins released by the bad bacteria inflame the lining of the intestines, and you develop a leakage, and toxins from the intestines and possibly even bacteria and viruses themselves leak into the bloodstream and literally wreak havoc. In fact, it's been implicated in possibly causing systemic lupus. Lupus is an autoimmune disease where it can attack your heart or your kidneys. It's been implicated in rheumatoid arthritis and many other conditions. So when you have sufficient healthy bacteria, they keep the immune system under control, and they actually very quickly heal the lining of your stomach and intestines. They promote wellness down there. Plus, there's a lot of things in fiber that feed the good bacteria. This is why a fiber-rich diet is so important, having a variety of fibers. In fact, when they put fiber and good bacteria together in a supplement, it's called a prebiotic with a probiotic. The probiotic is the food for the bacteria. My old friend Dr. Alan Pressman said, well, you wouldn't buy goldfish without goldfish food. Why would you buy healthy bacteria without healthy bacteria food? So in the diet, this is fiber. Fiber is a kind of starch that you can't digest and absorb. You'll find it in vegetables and whole grains and seeds and nuts and legumes, etc. So the probiotic bacteria work on the fiber, and they release a bunch of things. They release different acids like lactic acid and propionic acid that have a number of good effects on the digestive tract and on the brain, by the way. They help control your appetite. Deeper down the intestines, you actually release butyric acid. There's an interaction between good bacteria and good foods and releasing butyric acid, which does a number of things. The lactic acid, the propionic acid, and the butyric acid give energy to our immune cells in our digestive tract so they can function properly. But the butyric acid also heals the lining of the intestines very rapidly. The butyric acid also improves the absorption of minerals such as calcium and magnesium required for good health. Butyric acid also seems to normalize aberrant cells, damaged cells that are becoming mutated that increase the risk of developing a polyp, and certain polyps can transform into colon cancer. So having the good bacteria and the good foods is a win-win situation for your digestive tract, for healing leaky gut syndrome, and for health in general. Now, probiotic numbers decline for a number of reasons. If you smoke cigarettes, if you take certain drugs, a whole bunch of drugs kill probiotic bacteria. The most notorious one, of course, would be antibiotics. But many commonly prescribed drugs kill your probiotic healthy bacteria. I'm going to call them probiotic because that's the name you know from getting bacteria from like fermented foods like yogurt or kefir, or from a supplement. So we'll just call them probiotics generically right now. The strains of bacteria decline as we age. Also, it's weird, but aging is implicated in a reduced number and variety of gut bacteria. Using a lot of cleaning fluids. People are cleaning their houses like mad now with the coronavirus. They've been told to, but this also decreases the number of healthy gut bacteria. Sugary foods kill them off. Salty foods kill them off. Alcohol kills them off. So taking a probiotic is a good practice for most people. Also, obesity, having elevated blood sugar, like prediabetes and diabetes, that also kills off the number of good bacteria. So let's look at some of the studies on good bacteria and your immune system. The journal Nutrients reviewed 4 different studies of people in their 60s and 70s. They looked at a particular strain of bacteria called Bifidobacteria animalis, subspecies lactis, and they found within a few weeks it strengthened the activity of natural killer cells. Now, I mentioned in the first part of this episode, natural killer cells they're plentiful as we age, but they're just not strong. They've lost their strength. Natural killer cells identify viruses and identify cancer cells, and they're fairly early responders, and they kind of have a memory. They stick around until you have antibodies, until your T cells come in, very powerful parts of your immune system. Older people, they have plenty of natural killer cells, they're just not working. So it's hard for them to fight viruses like a flu virus or a coronavirus. They've shown that this particular strain, Bifidobacterium animalis subspecies lactis, improves the strength of the natural killer cells, but also the strength of neutrophils and macrophages. They're very early responders. For instance, when you get an infection by a coronavirus or a flu virus, your neutrophils and your macrophages are reacting within the first half hour. They really need to contain it and prevent it from becoming more dangerous. Now, in the Journal of Dairy Science, they looked at Lactobacillus plantarum. That's another great strain. It reduced the incidence of upper respiratory tract infections in adults. It also reduced how long you had the infection, the duration of the infection, and the intensity of the symptoms. But it also reduced pro-inflammatory cytokines. Now, those are the things that become dangerous in infections like Ebola or the COVID-19 infection. Pro-inflammatory cytokines overactivate the immune system and make it attack your own organs, kind of like a super concentrated, very fast onset acute autoimmune disease. And this could destroy your lungs, your kidneys, your heart, etc. So having Lactobacillus plantarum reduced the formation of these pro-inflammatory cytokines. That's actually a good thing. And it also enhanced natural killer cell activity, one of those long-lasting cells that really keep viral infections under control. In a Journal of the American Geriatric Society, McMaster University in Ontario did a study in 209 nursing home residents. They were age 65 or older. It was in 14 different nursing homes. Taking the strain Lactobacillus rhamnosus reduced the number of infections with a virus by 45% over a 6-month period. It shows you how important probiotic bacteria can be to enhancing and directing your immune system. Let's go to a quick break. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. We're talking about reestablishing immune system function in older people. In the first part of this episode, in part 1, we discussed zinc and we discussed melatonin. Now we've been discussing probiotic bacteria. And like usual, you need a healthy diet. Probiotic bacteria enhance the effects of a good diet. I'll give you a couple of examples. Cocoa has been shown to be great for brain health and circulation to your brain and for heart health and for like defending your lungs from the effects of pollution. But the active ingredients in cocoa have to be activated by probiotic bacteria. Otherwise, it doesn't work. Another example is green tea. Supping on green tea has been shown to reduce the risk of breast cancer and prostate cancer and colon cancer, strokes and heart attacks. But green tea doesn't get activated unless you have probiotic bacteria. I'll give you another example. Cruciferous vegetables. Those are vegetables like broccoli and cabbage and kale. The ingredients in them that lower the risk of breast cancer and prostate cancer have to be activated once again by probiotic bacteria. So in many ways, probiotic bacteria defend you. Not only do they help the immune system function better, not only do they reduce inflammation throughout your body and help protect you from some of the more dangerous aspects of your immune system, but they also activate those wonderful things in foods that protect you from different diseases. Now, vitamin D. Older people make less vitamin D when exposed to the sun. Normally, to make vitamin D, the cholesterol in your sun is irradiated by ultraviolet radiation coming from the sun, and it goes to a precursor to vitamin D that's stored in your liver called 25-hydroxycholecalciferol. This is released and it lasts about 2 weeks in your bloodstream. That's the type of vitamin D that your doctors are measuring. So when they say you have a high level of vitamin D, it's really a precursor to vitamin D. The next step, it has to go to your kidneys and be activated. You require the mineral magnesium for this, by the way. Then it becomes 1,25-dihydroxycholecalciferol. That's the active version of vitamin D. Older people, their skin has aged. It doesn't make as much vitamin D when exposed to the sun, just like darker skin or just like wearing sunscreen. People who wear sunscreen make less vitamin D. People with darker skin make less vitamin D. And people with older skin make less vitamin D when exposed to the sun. They really need vitamin D supplements. Immune cells, your T cells and your B cells, have receptor sites for vitamin D. This is unbelievable. Just like immune cells release melatonin to be activated, they have receptor sites for vitamin D to be activated. T cells activate different parts of the immune system and coordinate the fight against an infection. Plus, at the end of an infection, they tone down the immune response because you don't want chronic low-grade inflammation. That's dangerous. And B cells, this is the cells that make antibodies. These have receptor sites for vitamin D. It shows that if you lack vitamin D, there's less chance, if there's a lower ratio of vitamin D to immune cells, there's less chance that an immune cell will bump into vitamin D and be properly activated. So you need vitamin D to activate these cells and to protect us. Lacking vitamin D increases your susceptibility to infection, increases your risk of having lung involvement with an infection, so it's very important. Now, nucleotides are important. If you go on to PubMed is one of those websites that you could go onto for free. Everybody has access to it. It's called Intranew PubMed. And if you type in immunonutrition, a bunch of studies come up where they combine an amino acid called L-arginine, the mineral zinc, and a supplement called nucleotides. And these help people in many ways. For instance, they give this combination of people going in for surgery. There's been a bunch of studies on this. A number of the studies show that people who are going for surgery that take immunonutrition, which is based on L-arginine, the mineral zinc, and a supplement called nucleotides, their immune system is stronger. They have fewer complications from the surgery. They have fewer infections related to the surgery, and they recover and heal faster. They've done studies in people in ICUs, intensive care units, where they're out of the intensive care unit more successfully. That's a good thing. And faster with immunonutrition. So nucleotides is the core of immunonutrition. I take it if I start to feel something coming on. I'll take 3 capsules twice a day, and it gives such a quick immune response that it kind of bounces the infection out of me. It's a very good supplement. Vitamin C is needed for all immune systems. Your very early response cells, your neutrophils, soak up the local vitamin C. That kind of helps protect them when they get into the area of infection. The area of infection, there's a lot of violence there. It's very chaotic. There's all kinds of inflammation. There's all kinds of cells mixing it up, and there's a virus itself or bacteria. Vitamin C is needed to protect these early responding immune cells from their own chemical arsenal and from all the havoc and chaos that's going on by the infection, so they can literally get to the virus and help to quench it, help to kill it. Now, lifestyle factors. Eating a variety of fiber-rich foods to feed your good bacteria. Regular moderate exercise. This is important. When you do extreme exercise, it suppresses your immune system for about 6 hours. That means there's this long window of opportunity for you to get an infection or for the infection to become more dangerous. But regular moderate exercise, like taking a nice quick walk, doing some gardening, getting on your bicycle, that really seems to help your immune system work better. Smoking suppresses your immune system because it creates inflammation, which uses up your immune cells. Plus, it takes away the antioxidants that protect your immune cells from their own chemical arsenal. So smoking is bad. Alcohol, when you drink alcohol, when you have a number of drinks, it suppresses your immune system for about 3 or 4 hours. Sugary drinks, having a couple of sodas will suppress your immune system for about 3 to 4 hours by about 40 to 60%. So those are not good things. Weight management. Fat cells are metabolically active. They release inflammatory cytokines. This makes your immune system less effective, and it makes infections more dangerous. So try to keep the weight down to a healthy weight. Calm down. When you're stressed out, you release stress hormones. They suppress your immune system, so you want to calm down. A multivitamin. A multivitamin has a wide range of nutrients that are good for the immune system. Selenium, B vitamins, zinc, vitamin C. They're all important for immune system activity. And if you could get additional antioxidants like superoxide dismutase or lutein, these also help improve the function of the immune system. Thank you for tuning in to the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. We'll see you next time in another episode of the Invite Health Podcast, and thank you so much for listening.